Welcome to meeting number 6 of the House of Commons Standing Committee on Veterans Affairs. Pursuant to Standing Order 1082 and the motion adopted by the committee on October 27, 2020, the committee is resuming its study of the backlog of disability benefit claims at the Department of Veterans Affairs. Welcome to all the witnesses who have taken the time to join us. Thank you for being here with us virtually. I'll introduce each of you. Then we'll get started right into questions. I'll introduce each of you and then give you an opportunity to introduce. Each group will have 5 minutes, both during that as well as during the questions. At the 1 minute mark, you'll see me do this. Don't panic. A minute's a long time to finish your thoughts. And I tend to give people a little bit of latitude on this committee to finish as they are all here to contribute to our good work. So to begin to introduce, we'll start with the Royal Canadian Legion. We have joining us virtually Stephen Clark, National Executive Director. We have Raymond McGuinness, Director of Veteran Services, Diamond Command, and Chad Wagner, Provincial Executive Director from Saskatchewan Command. Welcome to all three of you, gentlemen. From the Union of Veterans Affairs Employees, we are joined today by Virginia Valancourt, National President, and Mike Martin, Communications. And from the Wounded Warriors Canada, we have Scott Maxwell, Executive Director, joining us. Again, thank you to all of you for being here. We're going to start with the Royal Canadian Legion, and I believe, Mr. Clark, you're going to start us off. So the next 5 minutes are all yours, sir.
Mr. Chair, thank you very much. Mr. McGuinness will speak on behalf of the Legion, but thank you for that invitation.
Fantastic. Mr. McGuinness, go ahead.
Honourable Chairman and members of the Parliamentary Standing Committee on Veterans Affairs, good afternoon. It is a great pleasure to appear in front of your committee once again. We support your study of the backlog of disability benefit claims at Veterans Affairs Canada. In a minute, I'd like to share some evidence-based advice. First, I want to outline very briefly how we are equipped to give such advice. As you may know, the Legion has been assisting veterans and their families since 1926 through our legislative mandate both in the Pension Act and the Veterans Wellbeing Act. We are the only veteran service organization in Canada that can help veterans and their families with representation to Veterans Affairs Canada and the Veterans Review and Appeal Board Canada. We do it through our trained professional and government security cleared command service officers and their assistants. To give you a sense of how busy we are, last year our command service officers prepared and represented disability claims on behalf of over 4,000 veterans to VAC and over 300 reviews and appeals to the review board. We also counseled out more than 1,100 veterans for various reasons. In addition to our Legion command service officers, every branch has an active and trained volunteer service officer to respond to the challenges facing our veteran community. With 1,400 branches across Canada, you can see that our branch service officers offer an essential network of support. They do not complete applications to VAC, but they are often our first line of contact, our boots on the ground. When we assist a veteran or family member with a first application or departmental review, it is a very thorough process, and we monitor a veteran's file for life, inclusive of reassessments. We don't send VAC applications unless they contain a confirmed diagnosis, and I can tell you it's a lot of work, and yet we take great pride in it. But here's what's changed significantly. The majority of our complaints are now about the backlog. When we are asked daily about the status of applications, this is even after veterans have visited their MyVac account and used the wait time tool, and they still call us. Why? They call us because the wait time tool is not accounting for the thousands of applications they have to process before they can get to your application. The tool provides information on averages over the last 90 days, not what you can realistically expect based on the current backlog and when your own application was submitted. For example, today you'll get a 44 to 66 week processing estimate for a single condition, depending on the type of condition. That estimate is not realistic, considering that the department is currently working on claims from November 2018. Yes, 2018. We would like the department to be more transparent, modify the wait time tool to reflect reality. Not only do we receive many unnecessary calls, We can't even tell veterans with any degree of accuracy when their claim will be processed and a decision rendered. We understand the backlog is huge, and we do applaud the department for trying to streamline the decision process with veteran benefit teams, limiting the transfer of files and providing the authority to the teams to make the decisions rather than requiring medical advisory consultation. They can also triage claims for disability benefits to expedite applications for veterans at a higher risk. We are also supportive of the department in combining conditions that historically have been a consequence of the initial condition, as long as there is a confirmed diagnosis for it. It will be crucial to implement such measures as soon as possible. I can tell you I've been with the Legion for over 9 years, and I have never seen so many applications. We have reached out to other veterans organizations, including the Canadian Armed Forces and the RCMP, to advertise our services, and as a result, we have seen a steady increase in applications and departmental reviews right across the country. The increase is also due to the change in the partial entitlement policy that the department quietly changed in February 2018. The change benefited veterans who have received partial entitlements in previous years and can now apply to receive full entitlement for causation and forfeits for aggravation cases. This one change alone resulted in many more departmental reviews and appeals. As an example, historically, the Legion would complete approximately 80 departmental reviews in a year. However, from August 2018 to December 2018, we completed 552. In 2019, we completed 601. In the end, we believe the department needs to further simplify its processes and get rid of some of the layers that may no longer be needed. Finally, I'd like to share a couple of important points about the Legion's work, which may be good background for your own work with our veterans. Currently, the Legion offers a free one-year membership to all still serving military members, retired military, RCMP, and retired RCMP who have not yet joined the Legion. It is called the Veterans Welcome Program, and it is an opportunity to stay connected to the military and policing family, to honor and support those who served and sacrificed, and to strengthen the community. Through our Poppy Fund, we raise and distribute close to $17 million annually to support programs such as Lead the Streets Behind program and to meet the essential needs of veterans and their families who have limited financial means. The Poppy Fund is available at all levels of the Legion and is accessible to veterans in need, including still serving members and their families. We work in close partnership with VAC and other funders to ensure our veterans and widows have a complete solution so they do not have to go without. I will end on this thought. There is no quick fix to this major backlog, and we do not see any end in sight. In fact, we believe that when the new transition groups are fully operational, more released personnel will be applying for benefits. There is a danger of the backlog becoming longer. We want to help the department avoid this disastrous scenario with some of the ideas presented earlier, and we stand ready to help further. Chairman, we thank you for the opportunity to make this presentation, and we'd be happy to take any questions.
Thank you, Mr. McInnes. Up next, we have for 5 minutes, Mr. Chad Wagner, Provincial Executive Director, Saskatchewan Command. The floor is yours, sir.
Thank you, Mr. Chair. I'm going to echo what Comrade Ray has just talked about. I did have some speaking notes here, but some of it's already things that he's already said, so I'm not going to waste everyone's time regurgitating things. I'm more of a get or done type of person and not keep beating things to death. We have seen an increase of claims. We've been doing our as much as we can to adjudicate or help them through the adjudication process. But some of the challenges that we see, I think, can be remedied by empowering the frontline staff of Veterans Affairs. Like I said before, this is about get it done mentality. There's no reason why our frontline staff, whether it's the VSAs, the case managers, or the field nurses, why they don't have the capacity to approve applications that are fairly clear. So hearing loss tinnitus, where we have an audiogram, we have a physician that says that there's hearing loss related to service. Why does it have to go through all the levels of adjudication? So not only transparency, but proficiency and efficiencies are really what's needed. Things such as chronic pain, a lot of chronic pain applications are usually favorable. It's fairly clear in their medical records that they have an injury due to service. Nothing's strange about it, but yet it still takes 19 months, 20 months to approve a knee injury. A quick, easy solution might be to have them be able to give a limit, whether it's 5, 10%, whatever the number it is, to be able to approve some of the supports right off the bat. Get them the treatment. The treatment is almost more important than the overall benefit. If we can get them into the treatment immediately with a little bit of support right away, that's going to at least get them so that the problem doesn't exacerbate over time. I think that there's some things on a proficiency level, on an efficiency level that we can look at, taking a look at mainstreaming some of the processes. And again, I'm just going to reiterate whatever Ray has mentioned in terms of the backlog. And you know, one of the challenges that we do see that would be a great help is for those that have to go to an OSI clinic for the first or second time. Some of these guys, they don't have the ability, they can't afford to go. So either they don't go, or they're relying on us, and that's a dangerous barrier for them to succeed. For them to admit that they can't afford something and they need help, that's not going to be successful. If they don't have the funds to get to the OSI clinic, they're just simply not going to go. There's got to be ways that we can provide them with accommodations, provide them with the ability to travel without any barriers to them being successful on achieving their outcomes. I'm just going to leave you with a quick story on how we operate here in Saskatchewan. We are frontline. I've got 2 service officers here that work with veterans every single day, and I liaise with them, I talk with them, and we have the ability to do some things at our level that might not be as easy at a federal level. But one of the things that we do here is we can have a veteran come into our office at 10 a.m. in the morning in need of shelter, food, medical attention, throughout our various networks, whether it's social services, Legion branches, various service groups. We can have housing established, food provided, usually a stream of income through social services, medical appointments set up, and starting the process for Veterans Affairs benefit claims, all by the end of the day. One day. I'm sure we can do better than 19 months, 19 weeks was the target. We can do better than that. It's all in the process of removing barriers, and it starts with empowering the front line. I'm going to turn it back over to you, Mr. Chair. Thank you very much for your time.
Thank you, Mr. Wagner, and thank you for the frontline work that you're doing. That is an astounding fact that you guys can pull that all together within one day. And yes, we definitely are likely able to learn from you guys in that regard. Over now to the Union of Veterans Affairs employees, and I believe Virginia Valancourt, National President, I believe you're speaking. The next 5 minutes are yours.
Thank you. Good afternoon. The Union of Veterans Affairs is a component of the Public Service Alliance of Canada, and we represent over 2,800 employees within Veterans Affairs, including most of the frontline staff who deal with veterans and their families every day. We would first like to give you an update about the challenges faced by case managers within Veterans Affairs. We remind you of the commitment since 2015 to reduce case manager ratios to 25:1 in order to allow for more time and focus on the needs of veterans and their families. We told you in March that the department has failed to meet that target. We are disappointed to tell you that nothing has changed. In fact, with the pandemic, things may be worse for case managers and other staff. And we know that things have not improved for our veterans and their families. Case managers continue to carry caseloads of 40, 50, and even over 60 cases. That is not just a workload issue. These are real veterans and their families who are not getting the services they deserve, the services they have earned. It is not just case managers. The situation remains troubling across the country. In April, UVAE carried out a survey of our members regarding their work with veterans and their families. We asked them to not only identify issues and problems, but to make suggestions for improvements. We have provided a full report from that survey in our brief to the committee. If you want a fuller picture inside Veterans Affairs from ground zero, we ask you to read the brief. We will highlight some areas for your information. In the survey, we covered everything from initial assessment and processing of applications through to helping veterans navigate the systems. We also focused on mental health services for veterans and their families and support for the UVA members who work in this area. The bottom line from this survey is that there is a high level of frustration among UVA members who are trying their best to serve veterans and their families. This includes frustration with having to use multiple incompatible systems, an excessive workload, and lack of communication between sections. And not surprisingly, there are many pleas, urgent pleas for additional mental health training and support. In intake and assessment, which is the first place that veterans access about their benefits, there are problems including inadequate resourcing and training and duplication of work. This is causing many problems for veterans and their families. It was even triggering mental health symptoms in some veterans as they had to explain their problems over and over again. In first contact resolution, where initial difficulties are supposed to be resolved, there are backlogs and delays in processing requests. The tools that staff are using also assume a certain prevalence of provincial support that is not always available in rural areas. All of this means longer wait times for veterans, and the information provided is not always accurate. That in turn causes more delays. With Medavie Blue Cross, the main benefit service provider for veterans, staff reported significant delays preventing veterans from getting their medication, services, or payments. This is not only an unacceptable way to treat veterans, it also negatively impacts the relationship between veterans and our staff. Our members also asked, who is in charge of benefits, Veterans Affairs Canada or Medavie Blue Cross? One concerning finding from this survey is that about half of the staff whose work involves mental health services for veterans felt that they have inadequate resources to do their work. They noted that referrals take too much time and that resources in rural areas are very limited. Over 2/3 of those surveyed said there are delays in getting veterans access to mental health services. Our members made numerous recommendations to improve services to veterans and their benefits. We urge the committee to take note of those. We have provided the results of this survey to senior officials at Veterans Affairs, but to date, we have yet to receive an official response. We will continue to press for positive changes for veterans and the people who have the honor to serve them. Back to the backlog of disability claims and the department's plan to deal with this issue. We welcome the additional resources that are coming directed towards this problem, but there are two basic flaws with this particular plan. First of all, it is proposing another temporary solution to a permanent problem. We have been through this process, put in temporary or surge resources to address problems in one area, and hope to reduce the pressure on the system. Some have called this a Band-Aid solution, and we would agree. But our veterans and the issue they face are permanent, ongoing, and growing. In fact, we refer to the current approach to dealing with the backlog as whack-a-mole. Reduce the pressure in one section and it pops up in another. Even if the backlog in disability claims could be resolved, the system would be overloaded at every other stress point in the system. In our view, it's time to stop the public charade of announcing the next big fix to whatever backlog is in the media and deal with the systemic issues at the department. We call again for a permanent solution to all of the issues at VAC and to provide permanent and secure funding for veterans and their families. That change has to be systemic, permanent, and one that accepts the reality that Canada has a growing veteran population with complex needs that require our collective support. Our veterans deserve better. Our union and our members stand ready to do our part to make that happen. Thank you, Mr. Chairman.
Thank you. And now over to from the Wounded Warriors Canada, Mr. Scott Mitchell, Executive Director. 5 minutes, please.
Good evening. Thank you all, Mr. Chair, all members of Parliament, and all those who've spoken thus far. I can only, I really just want to echo so much of what has been said to not repeat as well. Wounded Warriors Canada, for those that don't know, we're a national mental health service provider that specializes in clinically facilitated group-based trauma therapy programs for our injured veterans, first responders, and their families. When it comes to veterans, we're supporting just around, just over 1,000 members every year through our services. And I guess in terms of how we fit in this discussion is because while we don't support members in terms of their claims directly. What we see and what we are dealing with is the downstream effects and the consequences of disability backlog through the members that we're supporting through our services. Trying to figure out why. It seems like over the years I've come and presented at committee here, we have continued to talk over and over again about very similar things that aren't just aren't being rectified, and the consequences of it are having a significant impact on our veterans, their physical health, their mental health, their family, and I'll talk a bit about that later on. One of the things I wanted to mention that I've noticed through our organization as a bit of a challenge and might speak to some of the problems we're seeing in terms of getting this work done and rectifying these significant gaps is we have not had stability at the ministerial level through VAC in the last 10 years. Since 2010, there have been 9 Veterans Affairs Canada ministers, nearly one every 12 months. I reference this, just because to my point about what might be holding this up. I understand the department is there; they're doing what they do every day, and there's leadership in other places. But let's just be honest. I don't know if anyone here has run their own business or been part of a business, but can you imagine if the CEO of a business changed nearly every year? What kind of effect that would have on your operations? New policies, new implementations, new programs. Obviously, it just wouldn't be very effective or efficient at all. It's something that we've felt very strongly here in our work, trying to do more of it, trying to work collaboratively with the department. It's been very difficult having to go in and meet new people, tell the same story, highlight the same issues over and over and over again. So that's just something I wanted to draw attention to. Obviously, the subject is about security, dignity, and respect. I was listening to that veteran you had on a previous committee, veteran Thompson, talking through his very powerful and at times, for me, it was agonizing testimony, summing up the impact this backlog has created for him, for the veteran community at large, and by extension, their families. I really only wanted to echo his comments and to say that this is exactly what we hear and have heard for years from transitioning Canadian Armed Forces members to civilian life. What's more, we've heard that the transition from D&D to VAC must be seamless in an effort to help ensure our members are healthy and well in civilian life. It's something similarly that's been talked about seemingly over and over and over again. Given how much work needs to be done in this particular area on this subject, highlighted by those that have spoken before me, I would rank disability benefit claims at the very top of the priority list when it comes to making seamless transition a reality in Canada. For our perspective, one of the things I wanted to remark that might be a bit unique is, the impact this is having not only on the members themselves, but on their family members, that often silent support behind the Canadian Forces and our veterans, their spouses, partners, and kids. Through our program supporting those people, couples, spouses, and children of our injured veterans, it's important to note that added stresses and pressures of disability claim wait times is compounding the impacts and effects of operational stress injuries, such as PTSD, on both the individual member and their families. I'm sure everyone has read the literature review undertaken by the Veterans Ombudsman on veteran spouses that was released in September, really chronicling this whole, the research, the impact, what's been written, what's been discussed, and ultimately the findings from those members and their families themselves. And it was specifically interesting and profoundly impactful that spouses are suffering negative impacts to both physical and mental health prior to, during, and following medical release. This is consistent with our experience and something that we definitely feel needs to be rectified. I'm not sure if you've had a veteran spouse appear before the committee, but it might be a suggestion for future presentations on this matter when we're talking about and trying to address the impact. I look forward to communicating and having an ongoing dialogue with everyone here this evening. I thank you for your time.
Thank you very much, sir, and thank you as well for the work that you're doing on the ground to help veterans. It's amazing to see, and I thank you for being here and taking some time to help us with this study. We are going to get right into the first round of questions, and up first we have MP Broussard for 6 minutes, please. Sir, floor is yours.
Thank you, Mr. Chair. I want to get right into it, Madame Vaillancourt. It's hard within 5 minutes to summarize what's in a 36-page report. So I want to give you the opportunity, and there were several things, and I read the report in its entirety. There were several things that stuck out with me. And one of the things that we've been talking about, and I want to get your opinion on this, on the issue of some suggestions for improvement: simplify, 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 and stop using multiple systems. One thing that we're hearing consistently throughout the course of this study is that it's not necessarily the money that is thrown at the problem. It's not necessarily the people that are thrown at the problem. It's the process itself. And whether it's an attribution to service within the CF, the disconnect that exists between VAC and CF, the minister often talks about digitization of records, making sure those records are distributed to VAC. I'm just wondering if you can comment on the process system itself and how that can improve, in your opinion.
Well, thank you. Because there's many sort of layers and that of the process of veterans applying, it would be very hard in this amount of time to be able to sort of sink it down to one. The biggest concern is that there's too many layers, there's too many processes and procedures that are being put in place, and you put one in place today, something will change tomorrow, and you have to try and relearn that process and keep moving forward. So the biggest thing that we keep hearing from our members across the country is the processes themselves in the entirety need to be simplified from the time a veteran makes their application right through to the time that they deal with Medivie Blue Cross and being able to get their services paid for.
Because you do refer into the report, where it would be a much simpler process if veterans were sort of, and I've talked about this before, where they were guided through the process, preferably with somebody with experience who's gone through that process, because oftentimes they get frustrated, or perhaps they can't deal with the level of paperwork that's required in order to have their claims adjudicated through VAC. So maybe you can touch on that for a minute.
So I am going to refer to my comms Mike, who collected all of the data. He has more of the background in that. Mike.
Thank you, Mr. Broussard. There's a number of suggestions that are in throughout the brief, based on the survey we conducted with members across the country. And as Virginia noted, we need a simplification of the process. People find that there are many new benefits, but there are many different avenues that people go down, and we need to find ways to streamline that, and so that when people access the process, that they have an easy path to get in, and then they can move smoothly along. There's a real backlog at the beginning as people are trying to get into the process, and there needs to be additional resources put in the front end, and then the resources need to follow the people along. And the idea of having a guide or guides to help people through it is a great suggestion. There used to be more people who are actually doing that inside the department, but now what we found from the survey is there's less people that do that because they're developing processes and they're reporting on the processes, and we got ourselves all tied up in knots when we really just want to try and help the veterans.
Thank you so much. And for those members, I know we only received the report today, but for those members who have an opportunity to read it, it's a very compelling report with a lot of solution-oriented issues in it. Mr. Maxwell, I know you often speak about the downstream effect of this. You and I have had conversations in the past about transition and the impact that has on veterans. How can we simplify the process specifically?
Well, I mean, just echoing only what I just heard again, I think if as much as we can do before somebody releases is something that we've talked about for years now. Could imagine a day if all the claims could be adjudicated, the veteran at that time would understand what's coming in every avenue as part of the transition to civilian life throughout the release process. So once they were for those that were supporting medically released, everything was as crystal clear in front of them. not only for themselves, but again, for their family members. I mean, look at this report in September from the Ombudsman. Look at the chronicling of how much these stressors are compounding injury and to injured people who served our country. I find it almost horrifying that paperwork and process could, this is a form of, you look it up, this is a great term called sanctuary trauma. This is a very, very profound term. That is what happens to someone served, someone's done all they can for their country, and then they are confronted by, when they reach out and expect the support to be there for them, only to find it's another battle. And that's what we hear. It's another battle. So whatever it takes. I mean, frankly, I'm not a master for that necessarily, but I can tell you from what we hear, it's can we get as much done up front before they release as possible?
Right.
If we can do that, so they hit, as they always say, civvy street, civilian life, with the knowledge and understanding of what's coming, what support they're going to have, and actually have those supports at once. I think that would be a profound difference from where we are today.
Thank you, Mr. Maxwell. And it's
Thank you.
important to remember too that we're not, as we talk about the backlogs, it's not the backlogs. This is about veterans and their families. So thank you for sharing that information.
Thank you, MP Broussard. And now over to MP Casey for 6 minutes, please.
Thank you very much, Mr. Chairman. My questions will be for Ms. Vaillancourt. You started your opening remarks with an update from the testimony that you gave in March 12th, and you talked about case managers. We had this conversation on March 12th, but you would agree that once a veteran has been approved for benefits, then case managers are engaged. So while your members, the case managers, are important to you, they really don't have anything to do with the backlog. We're talking about disability adjudication. But I want to stay on the subject of your March 12th testimony because I found it interesting that you sought to update your testimony with respect to case managers whose connection to the study is tenuous. But you didn't provide an update with something else you said on March 12th, yet you had written to the committee to ask to update your testimony. So what I'm referring to is your reference on March 12th when you indicated that it's unfortunate that disability adjudicators are based in Charlottetown. After I contacted your membership here in Charlottetown and they told you how displeased they were, you waited 9 days before you wrote to this committee to ask to update your testimony. So my first question to you is, do you have the email that you sent to the committee where you asked for your testimony to be updated?
It would be in my folder.
Would you send it to us, please? I haven't seen it. But one of the reasons I haven't seen it is because the update that you asked to make was so different than the testimony you gave that the editors of the transcript deemed that it was inappropriate. So the testimony that you changed your mind on 9 days after you gave it is still part of the public record. I think that's a problem, don't you?
Well, I'm glad that you asked that. Oops. Yeah, I'm glad that you asked that question because it gives me an opportunity to clarify my previous remarks to the committee. First of all, I want to acknowledge that there are many bilingual people in Charlottetown and on Prince Edward Island. It was never my intention to say otherwise, nor did I or do I wish to denigrate anyone from Charlottetown, especially the staff at Veterans Affairs Canada and the members of the Union of Veterans Affairs employees who work there. What I did refer to the last time I was before the committee was the fact that there are challenges in recruiting bilingual professionals to complex positions within Veterans Affairs Canada. The department would seem to agree with me, since according to the testimony from one of my union colleagues last week at the committee, they are transferring bilingual employees into Charlottetown to meet existing needs. Mr. Casey, I hope we can move past this issue and refocus on why we are here today. Canadian veterans and their families are suffering, and we need to work together in order to bring them the best possible services and programs. We ask you to work cooperatively with the Union of Veterans Affairs to make that a reality for our veterans and their families.
I'll be happy to work cooperatively with the Union of Veterans Affairs employees when their absentee leadership stops smearing my constituents and unionized members that are not part of their union. And that's where I want to go next. You are aware that these technically proficient bilingual people who handle the complex cases are not represented by your union. They are actually represented by the union that we heard from in the last meeting, Doreen Weatherby. Did you let Ms. Weatherby, the person who represents these employees that you smeared, did you let her know of your comments at the committee on March the 12th?
I was not smearing any members in any way, shape, or form, Mr. Casey. It was the way I put it out. I said to pull those positions out. It was never meant to say pull those positions out. I'm clarifying my testimony to you. There are not enough bilingual qualified positions or people within Charlottetown at this time, and the department is actively bringing bilingual people from Ontario and Quebec into Charlottetown to meet the needs that are there. And we at Union of Veterans Affairs employees do in fact have members who work in the first application process as well.
Have you had that conversation with the union leader that represents these employees? The ones where you say that there aren't enough in Charlottetown, and you have refused to substantiate that when I've asked you to do so on March 12th, March 27th, and November 1st.
I have talked to the PIP's representative.
I find that surprising because she testified to the contrary. She testified that she was unaware of the comments that you made on March the 12th when she came before the committee. Which of you was telling the truth?
She's not aware of the specific comments that were made, but both Doreen and I have had a conversation in regards to the committee.
Will you now apologize to the people who you indicated it's unfortunate that the disability adjudicators are in Charlottetown? Will you publicly apologize to them now?
Well, as I said, there was no slaying of members in any way, shape, or form, but if that is what you are requesting, I apologize for anything that I did to upset you, yourself, Mr. Casey.
Thank you. I have no further questions.
Thank you. And now over to MP Desilets for 6 minutes. I believe you're in the room, sir.
Oui, tout à fait. Merci, Monsieur le Président.
I am indeed. Thank you, Chair. I'll continue in the same vein of questioning as Mr. Casey, but I won't be using the same tone. Don't worry, Ms. Vaillancourt, even though I do understand your comments, Mr. Casey. We in Quebec have 3 areas where Revenu Canada provides service.
Avec les anciens combattants. Tout est centralisé à Charlottetown et on comprend clairement que
veterans as well. Now, we understand that it's difficult to send people to Charlottetown. It's not a central location in Canada. What do you think of having more than one area where case managers could be working? I'd like to hear your answer on that.
Well, we actually have employees working all across Canada, and given the pandemic situation, we've been able to show that the work can be done from anywhere where the qualification is. So absolutely, we can have positions in any province across the country, in any community across the country.
OK. Toujours dans ce sens-là, vous savez probablement.
All right. You know that we have certain expectations with regard to francophones. There are double the numbers. What solution do you propose if ever there is no service center set up in Montreal or Ottawa to better process francophones' claims?
Well, I'm hoping that we never get to the point to not seeing service centers for Veterans Affairs in any of the provinces and communities. We fought very hard to get the 9 offices reopened that were closed because that has a negative impact on the service being provided to our veterans.
OK. J'aimerais juste.
I'd like to have your opinion on the fact that in January, 300 new case managers began to work. Did you notice the impact of their hiring?
We have still seen that there is a backlog, even with the additional hiring, because it does take time to learn all of the legislations and policies and procedures that are required and that are in place for veterans applying for benefits. So we do still see a backlog, and we're still waiting for staff to be fully trained on the positions.
Mais est-ce que les 300
But are these 300 employees already working, in your opinion?
The last update that I had is that they have and are continuing to hire those positions. I'm not sure from the department, because I am waiting for an update on how many are actively fully in seat and trained and ready to go.
OK. Madame Vaillancourt, est-ce que ce serait possible qu'on.
Ms. Vaillancourt, could we receive this information as soon as you have it at your disposal? There are 300 employees or 300 positions that were opened that are available. And in June, there was talk of 400 new positions. It would be relevant for us to have a follow-up with this respect. Could you do that follow-up for us?
If I can get the information from the department, I don't see why it can't be shared. I'm still waiting for information from a meeting from the beginning of October.
Merci.
Thank you. I have a bit more time, I believe, Mr. Chair. I have another question for you then. It's difficult to hire. It takes time, as you said earlier, to properly train new hires. What do you think? Would it be possible to use whatever means necessary to make the training more intense? In other words, make it less, take less time.
That would come down to the policies and the legislations that are put in place by the government, and the processes that are being in place with the department that follow the legislations that are put in place. We have no control over how those legislations that are put in place.
Je comprends, puis ça relève pas de vous.
I understand that it's not your responsibility, but based on your knowledge of these positions, because you work in this field, you know what the job descriptions are. Do you think then that this training could be given in less time so that these agents could be actively working much more quickly?
Brief response, please.
Without negatively potentially impacting the service to the veterans, no.
You have about 10 seconds.
OK. Parfait, c'est tout. Merci beaucoup.
Thank you.
Thank you. That's it for me.
Now over to MP Blaney for 6 minutes, please.
Well, thank you, Mr. Chair, and I want to thank everybody so much for the important testimony that you've given today. First of all, I want to start with all of the amazing Legion folks. I have 11 Legions in my riding, so I would take a lot of time to mention them all, but I've been to them all and have called them during COVID. And I just want to say what a pivotal role they play in our communities. And as a MP that represents more rural and remote, sometimes the Legions are the very place the community gets together frequently. So I just want to appreciate the work that you do, and of course the Legions that I have the joy to represent. I want to say thank you as well. Your statements really reflected the concerns that I have about how the backlog is impacting our veterans and their families and loved ones, and the terrible impact it's having. And I also have worked with a lot of veterans that are in financial dire straits and struggling. And unfortunately, one of the things that concerns me is the minister keeps referring to the Veterans Emergency Fund. In fact, he said in testimony, and this is a quote, "If there's a veteran or anybody at all who hears that a veteran is in dire need, we have the emergency fund, which certainly addresses these issues." What I've heard from veterans is, of course, this does not address the issue. I'm just wondering if you are either encouraging people to access the emergency fund, and if that is filling in the gap, as the minister is suggesting, for folks that are waiting for their disability pensions. Thank you.
And no, we're not encouraging people to apply for the Veterans Emergency Fund. If their application is in the backlog and it's complete, that's one process. Now, under the Veterans Wellbeing Act, people can apply for treatment or take treatment after 1 April 2019 on their own dime. And if their claim is favorable, then they will get that return reimbursement. But from what I'm hearing across the country, the Veterans Emergency Fund is being utilized. It's being utilized more than ever because the approval has been downgraded or downloaded down to the area level. So that's good to see. We're still seeing a increase in benevolent funding from the East Coast, not across Canada. We, as you know, we do a lot of benevolent funding, and it has not increased because of COVID or any explanation for the backlog. But there is a process in place. Just unfortunately, as you had mentioned before, many of our veterans don't have the financial capability to apply for or pay for that treatment up front. So they're in that wait. But if there's any, there is a process called the red zone process, which if the case comes to me on behalf of our service officers, I will take to adjudication. And that's claim is normally done with 7 to 14 days. But it's a concern right now with not only the backlog, but with reassessments and new first applications, is we can't get medical questionnaires completed because of the medical community. They're not seeing people in-house, and neither is the FACT doctors. So that a lot of people are not, and the doctors, and I just want to say one thing about the medical community. Now that they're reopening, they don't want to fill out Veterans Affairs medical questionnaires. They want to see their patients. So the veterans are getting hit double time here.
Yes, and I am concerned, as I'm sure you are, that this backlog that is already significant, we're seeing this quiet period because of that very issue, and we're going to see an increase of the backlog. Thank you so much. I would like to go to Ms. Valancourt. First of all, I just want to apologize. I imagine that was a bit of a stressful, and that's not necessarily how I would like to see committees run. Sorry that back and forth had to happen. I think you are focused so much on what veterans need, and I think we'll just focus on that. One of the questions that I have for you is that you mentioned that veteran service agents are applying for new positions as disability adjudicators, potentially creating issues down the road when those files that need to be managed and folks are not there anymore. Are there reasons why they want to leave these current positions?
Well, we've been working, as I said, on surveys and that's where, as much as the department is saying that they're bringing in 300 new employees to work on the backlog of the disabilities, some of the people who are being hired in those positions are coming from other areas within the department, which is going to leave a backlog in those areas and a depletion of those employees there. My concern is that as I said, it's sort of that whack-a-mole. You know, you were trying to fix one area, but we're instead creating additional problems in other areas there. And I apologize, I'm still riling, so.
Well, and one of the things that I wanted to clarify is there seems to be an assumption that the role that your folks play does not have anything to do with the backlog. Can you explain if that's the case or not?
No, we actually have employees, members who work in the disability adjudication section, including in the administrative aspect, reviewing the applications when they first come in, as well as the payment process of those claims when they are done. So our members do in fact work very closely with other bargaining agents within Veterans Affairs.
Thank you. I appreciate that clarification. I'm just wondering, how does the turnover rate for disability adjudicators compare with the veteran service agents or case managers?
Very, very brief answer, please.
I don't have the specifics on the turnover of the disability adjudicators, but I know the VSAs and the case managers. There is quite a rollover. We had a bunch of people who move over to the DEC unit, and others are actively looking to leave the department and or find other positions within.
Thank you very much. And that ends round one of questions. Moving quickly on to round two. We have up for the first 5 minutes, MP Wagenthal, please.
Thank you very much, Chair, and thank you all for being here. I too want to express my concern and my colleagues' concerns about the conversations that you were involved in there, Ms. Valancourt. That's not why we're here. And we're certainly concerned for our veterans. So thank you for your part in being here today. I also want to just bring up the fact that we have an issue here, as my colleague John Broussard said, about processes. Unless we make wholesale changes, we are going to be in this circumstance, as Ms. Weatherby said yesterday, ongoing. And you know, we need an efficiency business model here. I think, as you were saying, Mr. I forget who it was. Oh, Mr. Maxwell, I believe. We can't function in this way and expect to improve or change anything. So I do want to quote Mr. Gary Walburn, and I'm sure you've all heard this. He said, "The Canadian Armed Forces know when, where, and how you have become ill or injured. The Canadian Armed Forces should be telling Veterans Affairs Canada that the illness or injury is attributable to their service, and this determination be accepted." So, Mr. Wagner, you talked a bit about the dynamics around empowering the front line. First of all, if we made this change, which we recommended as a committee, and the government did not agree with that recommendation, neither does VAC, neither does the Canadian Armed Forces. So here we are trying to improve things, but really, if that was taken care of right off the front end, what change would that make to the number of first applications and the time length involved in veterans getting their care? Mr. Wagner, do you want to comment to that? I can't hear you. We can't hear you, sir. You're
Mr.
mute.
Wagner, I think you're, no, he's not on mute. I think his microphone is pulled up.
Your mic is up
Pull
on your head.
If you move your microphone down on your head, I think we might be able to
I do
hear
that
you.
all
There
the
you are.
time.
Okay. Sorry, I put
Thank
it up
you.
because I was getting in my way.
Sure.
I'm not sure if we're definitely not going to see a decrease in the number of claims coming through, but if what we will see is the instantaneous applications being approved. And if the Department of Defense is very clear in their paperwork that they have an injury due to service, and whether it's the VSA or the CM or whoever can just look at that and say, yeah, okay, it matches our checkbox, let's pass it, let's make the claim. Why does it have to go through the adjudication process?
Great.
There's a number of, you have to read all through all the medical records. Those medical records can be 18 volumes long, and it takes an hour per volume.
I have a question on that as well, sir. Just sorry,
Sure.
I have so many.
Yep.
We were informed by Mr. Hillman, he's the Chief Info Officer with Canadian Forces Health Group, that they're working on this improvement, getting medical records to VAC, but they say when they request them, and when the individual armed forces member requests them, would it not be much faster if they just immediately filled out a form that said, when needed, my medical records are available to VAC, and our adjudicators, our service officers, are you guys able to see those records directly? Or how do you get them?
Not until we get approval from the veteran to have access. Then we have to apply for access, and then Veterans Affairs takes about a week before we usually see them. Going back to what Ms. Valancourt was saying is there should be one system for all of this. Why do we have so many different systems where we have to go get medical records over here, ask permission, come over here, and then it just doesn't make any sense when it could be just one system, clear it all out. It should almost be streamlined as soon as they sign up for service at their Veterans Affairs medical file is just always working and always a cohesive unit. It doesn't make sense. Why it's
And
so many-
accessible. Like, I understand that there's
accessible, yeah.
only been 6 adjudicators in Charlottetown right now that have that access, and they have been trained. So I asked, well, how long did that take? And they said, well, just a couple of days. Why? Maybe I don't know who in this group would know about those adjudicators, and why is there only 6 at this point? This has been an issue since 2016. This medical record transfer issue. Why are we only at 6?
It's actually a pilot study, and it's not transfer of records. It's actually having Veterans Affairs link into the Canadian Forces Health system, so it's direct. Eventually, hopefully, that will be the way to go. But I will clarify one thing my colleague said about service health records. It's not a week we're waiting. We're waiting anywhere from 9 months to over a year in some cases, because still serving members, of course, have to have their files transferred, and there's no one working on the bases and wings right now because they're all working remotely.
Perfect. Thank you.
Thank you.
One more very quick question, sir.
If it's you got, I'll give you 10 seconds.
Sure, Mr.
Go.
Maxwell. I hear you speak of getting emergency aid to veterans within 24 hours. Vets Canada as well did the same. They were given 64 veterans to deal with because the emergency fund was too slow initially. Is that the best use of those funds, to have to work through the systems of VAC to get it? Would it not be better to have those funds available to organizations like yourself? Yes or no?
Very brief answer, please.
Yes.
Thank you.
That's a good brief answer. Thank you. Up next for the 5 minutes, MP Sampson.
Thank you, Chair, and I want to thank all presenters today. Very important information shared with the committee, and I appreciate the opportunity to listen to your information and to read up on some of the bigger reports if you want. I'd like to start off first question with Madame Vaillancourt. In June 2020, VAC established an integrated team to break down, of course, the silos, eliminate inefficient file handoffs if you want, improve the quality of decision making, etc. Have you heard any feedback from your union members about the impact of these changes?
No, not of yet, and I'm still waiting for information from the department in regards to those.
So since June, this has been put in place in June that the teams were started. No feedback whatsoever when you asked your members. I understood you asked your members again in September, October, what was happening on the ground.
So in September, October, we completed a second survey to do with the harassment, discrimination, and mental health in the department. So that's where our focus was, and that came out of the first survey results.
Okay, thank you. I'd like to go now to the union, to the Canadian Legion. I can't say enough for the work you people do, and you keep astonishing me with your stories on what's happening on the ground. I know I have 5 legions here in the riding of ACVA, President Jessica, and the help that you provide to veterans and their families is just exceptional, and I can't thank you enough. And I'm hopeful that the new funding that you are receiving that was approved a few weeks ago, if you want, is going to help you continue to do the work you're doing to help veterans and their family. A couple of quick questions. What are the most, in your opinion, any one of you can answer, what are the most common sticking points, if you want, that you see that leads to some claims taking much longer to process than others? That would be my first question. The second one, is there any, in your opinion, processes that we could change right away that you would like to suggest?
I'll start and I'll let anybody else jump in. But what I'm seeing the most is the inconsistencies. Like I said, I have in my testimony, I have no idea what to tell a veteran, except for the fact I know what month adjudication is working on and what year, but I don't know how many claims have been sent to FAC for that month or year. And then in some cases, I'm getting, I have the GM mentioned this the other day when he said the Legion had a case that was done in 10 weeks. But unfortunately, a part of that question that we had when we were speaking with the GM was that I also have a claim that took 80 weeks. And that was the 80 weeks versus 10 weeks. How do you explain that to a veteran who has a mental health condition, why it takes 10 weeks for one person and one veteran and 80 weeks for another? So it's the inconsistencies that are creating a lot of frustration right now. Frustrations with the fact they're not getting the answers when they send in, they're on step 3, say in their MyFAC account on a disability application. What does that really mean? No one's given them a definitive answer. So and of course, everyone thinks of money. And I'll go back to what Chad said before. We look for entitlement. Entitlement means treatment. Treatment is the most important part of this whole process. Of course, not for every veteran. Some veterans are only looking at the financial assessment. And one of the things that happens, and a lot of people say, well, let's move that claim up because they're in financial need. There is no guarantee that that claim is going to be favorable to begin with, but it's the entitlement portion that we'll go with. And when it comes down to how to speed up the process, they have a lot of good initiatives on the go. They just haven't put them in the action yet. And one thing about the veteran benefit teams that you mentioned, yes, they started in June. They are spread across the country. There are good ones with one's taking care of the RCMP, one's the Francophone VBT. So we're starting to see some claims coming through now, but we need more of them. We need them up to speed. You talk about training for the VSAs, the new employees. Between ourselves and my command service officers across the country, the training is complex. You know, the disability application process is complex. You can't speed up that training. We're not going to see benefits of these new employees until February, March timeframe. And right now, the ones
I'll thank you because I don't have much time. Two quick
You have
questions.
10 seconds, sir.
Two
Go
quick
ahead.
questions. You mentioned that the OSI clinic that they traveled wasn't included. My understanding it was for veterans. And the second one is you talked about empowering frontline workers. And I believe that there has been changed that allowed frontline workers to adjudicate up to $10,000. Are you aware of that?
Very, very brief answer, please.
that was not my testimony, but the $10,000 is just on the Veterans Emergency Fund. Frontline workers cannot adjudicate claims. And
Thank
we're
you.
talking about the backlog here.
Thank you very much. Sorry, folks. My job officially is the official interrupter, so I apologize for that. Over now to for 2.5 minutes, MP Desilets.
Merci, Monsieur le Président. Avant de commencer,
Thank you, Chair. Before starting, I'd like to congratulate 2 recipients of the Veterans Ombudsman Prize, Madame Brigitte Verdure, working with female veterans, and members of the LGBTQ community. And the second mention is for Marie-Claude Gagnon for her excellent work that she does helping veterans affected by sexual assault in the military. A question to Mr. Maxwell. I particularly liked your speech that says that we should work beforehand, upstream. That's very logical, working on prevention. Yes, we're talking about backlogs, but if we could get in there a little earlier, that would be better. So before releasing the soldiers, for example. And you said that perhaps there could be some cleanup or reorganization, that while people are still with the forces, there could be work on medical files, for example.
Yeah, great. Correct. Oh, thanks for the question. That's something we've heard time and again, that when we talk about healthcare, we're talking about medically releasing injured veterans, injured members of the Canadian Forces. Timely access, we always say in healthcare, is key. I don't know why it's not similarly being seen that way when it comes to timely access to disability benefits and awards that they're entitled to and deserve.
qu'est-ce qui empêche que ça se fasse, Monsieur Maxwell?
What's stopping us from doing that? Why can't this be done when people are still with the forces?
It's a great question. It's something I've asked time and again. The release process takes time. You don't just medically release tomorrow. There's often 6 months to a year time frame or longer sometimes. There is a period here. There's a window in which we should be doing this right off the bat, making that transition somewhat seamless, if not entirely, so we can begin to put in place these processes early. So at the end of the day, a veteran doesn't have to leave their family, the Department of National Defense, and have to retell their story time and again in an entirely new world.
Thank you.
Oui. Ben, on le comprend tout à fait. Moi, je suis nouveau au sein du
Thank you. We completely understand. I'm new on this committee, and a few months ago, I learned that there is a 3-day training course offered to veterans when they are being released. 3 days training to explain what they can expect. Would these 3 days, are these?
We're already 30 seconds over time. There might be some time at the end to ask a final
Parfait,
question,
merci.
but we got to get there.
Merci,
Sorry.
désolé.
Thanks, sorry about that.
That's okay. Next, we have MP, oh, sorry, I lost my spot here. MP Blaney for 2.5 minutes.
Thank you, Chair. And Ms. Valancourt, if I could just come back to you. I'm just looking for a little clarity. Is the skill set and education required for a disability adjudicator the same as a veteran service agent or case manager? And are these positions within the department at all transferable?
So the educational qualifications are not the same for the positions, and they've actually just again changed the education requirements for the case managers. And they could potentially be transferable in some degree, but not for, it depends on what the veteran service agents or case managers have in their sort of knowledge and skills on whether they would be able to potentially do an acting or a developmental opportunity, but they do require sort of that nursing background in adjudication.
Thank you, that's really helpful. You know, the Parliamentary Budget Officer did do a report that talked about the need to substantively hire more people and to stop referring to them as temporary hires, which is what we're hearing again and again from the minister's office, and call them permanent. The ministry seems to think that they did not get all the information, which the PBO was very concerned about because, of course, to do their recommendations, they asked for that information. But basically, with the framework that the ministry is using right now, the VAC, means that veterans will have to wait until 2023 to even get that backlog caught up. I'm just wondering, when you hear, Ms. Valancourt, that hiring more people could get that flow happening faster, get veterans the money that they deserve quicker, what do you think about that? Is that a plan that makes sense to you?
We need to have more resources right across the board in order to properly support our veterans. And the biggest issue is trying to get them the treatment that they need in a timely manner. And we need to beef up every position across the department, from intake right through to case managers through. Absolutely.
And Mr. Maxwell, I saw you nodding. I'm just wondering if you had a comment on that. You're on mute.
You're on mute, sir, and just a brief answer, please.
Okay, sorry. It's frustrating to hear to know the problem and the scale, the scope, and every size of the problem at large, and then hear words like temporary. I mean, this is not a temporary problem. It's been happening for years. We need to put the resources in place, and if we can do it and it can be fixed, why wouldn't we?
Thank you. And now over for 5 minutes to MP Carey, please.
Thank you very much, Mr. Chair, and I want to thank the witnesses. I'd like to get right to it. I have so many questions. First, probably Madame Valancourt. My colleague, Mr. Broussard, told you or mentioned that we really do appreciate the report and your contribution, because this is about the veterans. We're looking for solutions, and hopefully we can come up with something that the government can use as a playbook to fix the backlog. One of the things we've heard is because of the pandemic, most of your workers, I guess, are now forced to be working from home. The offices are closed, and I was just wondering, has that affected your ability to process claims?
On the onset of the pandemic, absolutely, it slowed down the process because not everybody had the proper equipment, desks, and stuff like that, and printers, that sort of thing. And in the adjudication aspect, the files are physical. They're physical files. So those aren't necessarily able to consistently be sort of transported home unless you make sure that you have all the proper lock equipment to be able to actually lock that up securely. So on the onset, it did, absolutely.
How are you doing now? Are you back up to reasonable times? Is it consistent with what you were doing before? Do you know? Or do you have any data on it at this time?
I don't have specific data on that regard. We are and do know that the output of work has increased, but
Good.
I don't have the numbers to that, no.
All right. Well, if you're able to get it, I'd be very interested in that. I also wanted to come back to a point that Mr. Maxwell mentioned. We had a veteran in front of us, Mr. Thompson, last meeting, and frankly, I was really shocked about how the process moved. And we had Mr. Walburn before say that the process is not fixable. However, we have to work within what we have. But here we had a veteran who was medically discharged from the Canadian Armed Forces, but he had to wait for the Veterans Office to like months and months and months to make sure that it was attributable and that it would go forward. So since we are looking for solutions, one of the things that Ms. Wagenthal has brought forward is why don't we just have people who join the armed forces sign a form ahead of time and say, look, if it's required, can we have a VAC to have access to your medical records? Do you see any downside of that, Madame Valancourt? Would that be an efficiency that would be easily implementable?
I think that it would be easily implementable, yes. Whether I think it would fully work, I'm not sure, because there's been such a battle with trying to get service medical records now, and sort of the challenge between the two departments on access versus who has the right to that access.
Yeah, we're just thinking of solutions here, and we don't want government departments fighting, because this is about the veterans and getting the benefits to veterans as quickly as possible. So I appreciate your comment on that, because I think that's a really good suggestion by Madame Wagenthal. We also had different veterans organizations talk about pre-approval of certain, conditions, especially the musculoskeletal, tinnitus, things that are very common. Do you see any downside of a pre-approval type of process? Would that affect your members on the ground? Would it help them be more efficient, do you think, on certain cases?
I think that it potentially could be, but in the brief that we provided to you, there's actually recommendations from staff themselves in regards to looking at the potential of automatic approvals and having sort of a fraud section set up to review cases after the fact, similar to CERB.
Yeah, I think it might have been Mr. Wagner who brought it forward, like the mentality of our men and women in uniform. We send them into dangerous situations, and we just tell them to get it done. And Mr. Wagner, I think you brought that same quote to the committee, and I appreciate it very much. You said to empower your frontline workers. What do you think, Mr. Wagner, as far as the job that you do, if there was an ability to have access to the records by people working on the form for the veteran, would that help streamline it, especially if we had permission in advance from the veteran to allow that? Would that help you on the ground?
Oh, absolutely. It would help us.
But
I think what talking to the frontline staff of Veterans Affairs and using their solutions would be the best thing for all of us. They're the ones that are there.
Okay. Thank you, Mr. Chair.
Thank you. And for 5 minutes, MP Lalonde, please.
Thank you, Mr. Chair, and I'll be sharing my time with MP Casey. Just to thank you all for being here again, and for some of you, it's a reacquaintance. I want to give a shout out to our Legion for a great poppy season. Certainly the 632, according to our number, that was the close today, is $100,000 raise for our Legion in 632. So I want to say, take this opportunity to say bravo. I think I would like to focus, Mr. Maxwell, on one aspect. You mentioned that you had about 1,000 members I wanted to know out of those 1,000 members, how many are women veterans that you're servicing?
Yeah, it's not the majority. I'd say it's probably about probably in around 80-20 male to female ratio. And it's probably and then conversely, it's the same on the couples spousal programs that we have. Actually, it's a lot higher, that it's almost predominantly women, female. So it is kind of what it is. The makeup historically has been, and we're certainly seeing that on the downstream side of treatment.
And have you heard any, I know we're talking about the backlog at large, but I was wanting to focus a little bit on the woman perspective today about your 80-20. So out of the 20% that you're servicing, have you heard longer wait than already existing, sadly, wait time for our veterans having access to any benefits?
Yeah, it's consistent, both either male, female. That's I think just speaks to the scope and scale of the problem, is that it's consistent for whomever is trying to go through this process upon release. And what we see, and it's kind of, sometimes it feels as though 50% of what we're trying to support and treat through our programs is the injury sustained as a result of their service. Then the other half of their struggle and their challenges and through their operational stress injury is the treatment they feel they're receiving by their own country through their own departments. It's a significant struggle and challenge for these folks, having to retell their story, feeling like they're just a number, not getting the help in a timely fashion, and of course the downward pressure that then places on their spouse or partner, on their kids. I mean, it can spiral out of control pretty quickly and compound what is already significant trauma-based injuries.
Thank you very much. And just one last thing, and I know if I want to share my time, we had a testimony regarding one of his recommendation of Mr. Sauvé was fast track application for clients who are medically at risk or have urgent health needs. That was one of his recommendations that the committee should look at. Any thoughts on that quickly?
That process is already in place with Veterans Affairs. It's called the Red Zone Policy. So if there's an application that is into Veterans Affairs, or if we're applying for a disability benefit, if there is those unmet health needs, we can request Red Zone.
Great. Thank you very much, Mr. McInnes.
Mr. Casey, you have about a minute and a half, maybe a little bit more.
Thank you, Mr. Chair. First, a couple of my colleagues have felt compelled to apologize to one of the witnesses for the manner in which I posed questions. I'm not surprised to hear it coming from Ms. Wagenthal, who also advocated for pulling jobs out of Charlottetown. But I can say to all of my colleagues here, if there was anyone that publicly advocated to take jobs out of your community, I'd be very, very surprised if you would react any differently. Ms. Vaillancourt, I asked you to substantiate your position that the pool of available employees in Charlottetown is limiting. I've asked you to do that now on 4 occasions and you haven't, so let's try again. For the position of the disability adjudicator, can you tell me how many people have been screened into the hiring pool? Can you tell me what the rate of bilingualism is in Prince Edward Island? And can you tell me what the rate of unemployment is?
Brief answer, please.
No, because that is stats that Human Resources would have, and you'd have to go to the department to get their hiring stats for that.
So you have no evidence?
I don't have specific stats because I'm not involved in the staffing processes.
You can opine that the hiring pool is limited without having stats to indicate whether or not that's true.
Yep, the hiring pool is limited in regards to the recruiting bilingual professions to complex positions within Veterans Affairs in Charlottetown. And my sister, Doreen Weatherby, noted the same thing to you, and the department is actively hiring outside to bring into Charlottetown.
Point of order, Chair.
Thank you. Thank you. That's time.
Point of order, Chair.
Sorry, I can't see it. MP Wagenthal.
Yes, I'd just like to respond to this with that accusation. What I am suggesting is a change, and we need changes here. I'm not saying pull them out of your riding, Mr. Casey. I'm saying get the jobs across the country where they're needed. And quite honestly, your government did exactly that, pulling an entire immigration service out of Vermilion.
And I have to interject. It's not a point of order, but thank you. We are done now, the second round. We have about 4 minutes by my clock left. I don't know, we don't really have time to start another round, but if there's any desire for a 30-second question from each of you for a 30-second response, I'm willing to offer that up. I don't see any hands as of right now from any of you colleagues, but maybe one of the witnesses, Mr. Maxwell, please.
Monsieur Desilets has his hands up.
Oh, Mr. Hand. Oh, okay. Sorry, I'm looking at the.
And I would be happy to take a 30-second question, Chair.
Okay, let's do this properly here. We have about 3 minutes left. We'll start with MP Desilets. For if you next 30 seconds, yours, sir. If you can make it very brief.
Ça y est, c'est parti. Merci, Monsieur le Président.
Thank you, Chair. Mr. Wagner, you mentioned that one single system would be beneficial. Could you just dream for a few minutes, well, a few seconds, and tell us what this one system would look like?
They just have to integrate. That's all they have to do, is be able to be integratable between them, be able to speak to each other. That's all we're looking for.
Thank you. That respects the amount of time we have here, so thank you for that. MP Blaney, please help us out and do the same.
Thank you, Ms. Valancourt. I just wanted to ask quickly, we know that applications have slowed down because of the pandemic. Is there any preparation happening to deal with the influx that's coming?
Just off of the funding, the temporary funding that the government's provided, that's all they're doing. They're working on hiring, and nothing else, in my opinion, has really been discussed about the influx coming in.
Thank you. And I don't see any more of my colleagues with their hands up. I don't know if they can tell me in the room if that's the case, but I see Mr. Maxwell desperately wants to get in one final point here.
I just want to make it, if any time to get this done and move on things, it's now. I mean, the pressures with this pandemic of COVID on individuals who have lost access to a lot of things and tools, and that they've sought to look after themselves, to care for themselves, the downward pressure on families. It's just to a level we've never seen before, certainly through what we see here every day and the Legion, et cetera. So the time is, let's get it done now.
Thank you. And MP Lalonde was waving feverishly. Maybe 15 seconds, go.
Well, I just want clarification from Mr. Maxwell. I asked about your 1,000, and I just want to clarify this for my own record.
Sure.
So out of the 1,000 members, you said that you have 80% who are veterans male,
yep,
and 20% who are veterans female.
Correct.
Am I correct to understand?
Yeah. Correct.
Okay.
Thank you.
Perfect.
Thank you. And I see Monsieur Broussard has your hand up in the Zoom. Go ahead, sir.
Mine's a point of order, Mr. Chair.
Please go ahead.
If you don't mind. First, Madam Valancourt, I do apologize on behalf of our side for the line and tone of questioning. And I would hope that Mr. Casey would show the same indignation to the Library of Parliament, who put a question in the briefing note today about the very subject that Madam Vaillancourt spoke about. Secondly, Mr. Chair, I want to talk to you about the time. This is the second time that we've had a vote after QP. The votes are taking a excruciatingly long time to happen, which is cutting into the witness time. This is an important study, and this is the second time that we've started at a minimum 45 minutes late, not giving, in my opinion, the witnesses enough time to answer many of the questions that we have as MPs related to this important backlog. So I'm asking you, Mr. Chair, for some consideration. I'm asking the committee for this as well, to extend the time if we do have votes, because our meetings have been set now Monday and Wednesdays. That's twice this week that we've had votes after QP. Typically, I expect that we're going to have other votes on at least the Wednesday based on opposition day motions that may happen and supply days that may happen on Tuesday. So we need to be fair to the witnesses who are giving their time freely to us. At our request on these important matters, we need to deal with the time issue, Mr. Chair. I'm asking respectfully that we extend the time so that the witnesses can give the testimony that we need to hear.
Thank you, Mr. Broussard. And I do recognize that this time slot puts us in a unique position in having this occur. If you recall, we had this discussion in committee business, and we actually directed the clerk to not have two panels for that exact reason. So we are successfully getting through 2 solid rounds of questions, and normally when we have panels of 3 organizations or less, we normally split it up into 2 1-hour sessions. So I hear what you're saying. I think it is disruptive. It has to happen to somebody on committee. Some committees have to bear this in terms of the timing. I don't schedule the time slot, as you know. But we did anticipate that. We are getting through, like I said, those 2 solid rounds. But if we have some suggestions, we do have technical limitations in terms of extending. But maybe you and I can chat offline, and we can look at how to proceed moving forward. Seeing no other hands raised, I will like to extend my appreciation and thanks to all the witnesses and all the members for their work on this study. I believe, clerk, correct me if I'm wrong, but I believe this is the last witnesses for the backlog study. And I want to thank you for all the work that we've done. And we still have more work to do. We've got the report to review and recommendations to bring to the House, and I look forward to that. And I want to thank all the folks that are sitting in Ottawa, helping make this possible, that we can get these meetings done virtually. Thank you very much. And if there's no objection, I move to adjourn the meeting. Thank you.
Thank you all.